Hi, everyone, and welcome to the SRHM podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action.
Welcome, everyone, and thank you for joining us for this special podcast episode today. I'm Eszter Kismodi, Chief Executive of SRHM, and I'm delighted to be your host today. This recording and conversation today is in recognition of May 28th, the World Menstrual Health Day, Menstrual Justice Day, Menstrual Hygiene Day. And I'm very, very welcome our two guests, Lizzie Kiama, Managing Trustee of Disability Trust, who is joining us from Kenya, Nairobi. Hello, Lizzie. It's very nice to see you.
Thank you for having me, Esther. Very nice to see you.
And I'm also very welcome Tara Mukeku-Cilolo, Associate Director of Sangpur Sang Project of Feminista, who is joining us today from Paris. Thank you so much for being here, Tara.
You're welcome, Esther. Good morning, and thank you for having me. Good morning, Lizzie.
As we were preparing for this podcast, we were discussing, are we calling our conversation or dedicating to Menstrual Health Day or Menstrual Hygiene Day? And we decided, because of the angle of the conversation, that we talk about Menstrual Health Day in a broader context of justice and dignity and rights. Just a little bit about Menstrual Health Day. When I looked at the official website of this day, it says only 10 years ago that menstrual health and hygiene was buried under a thick layer of science. Hardly anyone talked about the issue in public, and it was not mentioned in the media, all due to the taboos and stigma surrounding it. Silence is deadly for social issues. When they are covered in silence, challenges that surround them don't get addressed and they don't become relevant for decision makers. That is why WASH United initiated a global day dedicated to menstruation, the Menstrual Hygiene Day, on the 28th of May. And since then, as we are looking at around the world, it's a very powerful collective action, actually, that surrounding this day. And it's really a movement, and it's surrounded around collaboration and continuum for change. So I'm really excited to be here with you today, Lizzie and Tara. And maybe Tara, I'm starting with you. Can you please talk about Feminista's initiative? It's very exciting that it's called the Menstrual Dignity Initiative. Can you tell us about your framing and what the initiative is about?
Thank you very much, Esther, for your question. So 100% actually is a French word, right? It's a play on words, right? Because sang, S-A-N-G, in French means blood, but it also means like 100. Like the way it sounds also mean like 100, like the number. So if I have like to give, for example, like an English translation, it would be like blood for blood. So that's the name of the project, and the initiative was launched in 2024 and is being active is like in 9 countries across Africa, Asia, and the Caribbean, and uniting more than 100 like CSO in these 9 countries, but also social enterprises who confront menstrual discrimination. It's a project who has the ambition also to lift up the voices of the most excluded from from classical, if I can say it like that, menstrual health initiative, and also push for laws and policies that protects like the rights of menstruator. The project is like led by a consortium of 4 organizations, Equipop, PSI Europe, and the Global South Coalition for Dignified Menstruation, with Feminista leading the consortium. I think one of the most important thing on this project is it's like a core principle, which is like menstrual justice. Through 100%, the use of menstrual justice, of menstrual dignity is not just like a language matter, but it's also like something political. It's also like the political backbone of the project. The hygiene framing rooted into WASH allow us now to go beyond that, to deepen like the perspective by talking in terms of rights, because we want to have like an holistic approach, because we believe that if menstruators don't have like the possibility to menstruate with dignity, it means without fear, without shame, without taboo, with all the information that they need to go through that process without fear. We need to have a holistical approach. It's not only about like accessing products, which is like super important, right? But it's not only about accessing products. It's also about, for example, social norms. It's also about cultural like perceptions. It's also about public policies. So the ambition of the project is to have like this holistic approach to this holistic approach, deeply rooted into menstrual justice.
Thank you so much, Tara. I really would like to come back here because I think both of your framing is very much around rights and justice. But I would like to go, before going deeper, to Lizzie, that could you tell a little bit about your program? I think it's very important for the listener to know that the name of organization is Disability. And it stands for a concept as well. You are working with and leading your project with women with disabilities, and it's deeply rooted around sexual and reproductive health and rights. We have been working together more than 10 years with such a great pleasure of connecting with you again. So can you tell us, Lizzie, a little bit about what you are working on and how menstrual health, menstrual justice is situated in your program of work?
Thank you. Thank you so much, Esther. Indeed, it is a pleasure to see you and to collaborate on this conversation. So I run Disability, and we work primarily with women and girls with disabilities, focusing and prioritizing their sexual reproductive rights. We specifically focus on sexual reproductive rights because we believe the personal is political. And for women with disabilities, there's a lot of erasure in both policies and programming of who they are as women, their bodies and their needs, and how they take up space, and how they exercise leadership. So within Disability, we developed a program called Mama Siri, which again is a play on words. It is Swahili for woman who keeps a secret. And we developed it during the pandemic because of the lack of access to services that women with disabilities were telling us was prevalent, the isolation that was happening. So we developed this toll-free service that employed women with disabilities in different counties in Kenya to provide community care work. So these women respond to issues around, lack of health services. And a lot of the calls that we receive are around menstrual health, the lack of affordable menstrual health products in the community, the lack of income generation that has a direct impact on, how they can afford, the lack of accessibility, women in rural areas, for example, facilities are few and far between. And so, affordability and accessibility is not prevalent. Then we went into the school system and realized that girls with disabilities, there's a lot of, don't have access to safe spaces where they can have conversations around menstrual health and hygiene. And a lot of us, this is where we had these conversations at home and in schools. So when we take away, when shame shrouds those conversations, we take away the opportunity for girls to grow up, with pride for their developing bodies. In 2018, a girl was shamed in Kenya because she had stained her dress. And so we looked at the reality for girls with disabilities. And this was a non-disabled girl. So we went into schools and had conversations with girls with disabilities. And then we created a very controversial a campaign around, the realities of menstruating and the limitations of girls with disabilities. And that elicited a lot of negative public perceptions around disability. There was a lot of questioning. People did not want to come to terms with the realities of girls with disabilities and period blood. On one hand, the women's rights movement was talking about positivity around menstrual health and hygiene, but on the other hand, the same people were opposed to having billboards showing actual blood and girls with, physical disabilities. These were apparent disabilities. So there was a disconnect, and we realized that is translated into our policies and into our programming. And we really need to pay attention to that and create spaces to have more open conversations. So that's a lot of what we try to do. Thanks.
Thank you, Lizzie. And I think it's very interesting that maybe 20 years ago, it was very difficult to talk about rights and justice. People didn't understand. Now we talk about rights and justice, but if the billboard is actually showing blood and disability, then there is stepping back from the concept of rights and justice. So can we stay in, Lizzie said personal is political. Tara, you talk about menstrual discrimination. Can we go deeper? What this political means? What actually the dignity that is the slogan of your menstrual dignity is your project? What does it exactly entail, and how it translates to communities and politics and politics and culture and society?
Yes, I think that when we talk about menstrual dignity, something that comes with it, obviously, is menstrual inequity, right? So it means that it's not just that people don't have access to products, it's also that menstruation is like a site where broader structural inequities in health, in education, in economic participation, and bodily autonomy converge. Right? So when, for example, we have a young girl that is missing school because she don't have like access to products, access to information. It's not only like if I can say it like that, a hygiene failure. It's a failure of educational rights, of gender equality, of economic access. And I know, for example, that at the very beginning of the project, we conducted like a baseline research where I think almost like 9,000 of respondents across like the 9 countries of the project. And like this data shows that menstrual discrimination doesn't affect everyone like equally, right? And I think it also echoes what Lizzie was sharing with like the intersection of menstrual health and disability. So the most excluded people are like girls and women in poverty, people living with disability, people living in crisis contexts. I'm thinking, for example, of people in Haiti, and also this in rural or under-resourced like areas. So I think that intersectionality, when thinking in terms of dignity, is not optional. I think it has to be like the analytical core, if I can say it like that. And in practice, I think that dignity in practice means like the right to menstruate without shame, without taboo, without fear, without embarrassment. It means having access to information, services, supplies, infrastructure. And it also means that you are evolving as a menstruator in an environment where menstruation is not like a source of humiliation, of exclusion. So I think that we have like these two dimensions within the project, like something very material, in the sense that the project supports in the 9 countries social enterprises to produce local product, to manufacture them locally, and also to be able to distribute them locally, based like on an approach who centers like the price, like the affordability of the product, the fact that you can keep it like on your pocket, and also the fact that it's like something like planet friendly, and something also another dimension that is like super normative, where Force Feminista, for example, supports partners in country to work on political engagement, on policy change, and we are already able like to see the result of that. We have like several organizations supported through 100% in Nigeria, for example, who were part of the technical working group, who play like a crucial role in the adoption of the first ever national menstrual health policy in Nigeria. So yeah.
Lizzie, you are also working in a multi-stakeholder advocacy framework, and also you are working in different counties. And I know that during we had several conversations actually during COVID that what became the reality of many people during COVID. It's at that recording you said that it's a reality of girls and women living in every day. And it was very much resonating in me as well. And you talked about technology. So how access to services, technology, politics, discrimination comes together when you are addressing sexual and reproductive health more broadly for women and girls with disability, but also in relation to menstrual health.
Thank you. Thank you, Esther. I mean, I think for us, as I said, Mama Siri came about as a result of, the pandemic, and we utilized the fact that we were all forced to work from home to leverage technology across all our programs. So as I said earlier, we then developed this toll-free platform that responds to women and communities of women and girls in 20 counties now. And it provides localized service. So at the helm of this is a woman with a disability who leads this work, and we refer to her as Mama Siri. And that's actually what we are saying for inclusive programs to work. We have to look and see women with disabilities as leaders, not only as beneficiaries of programming, because if we truly want to design processes, policies that are truly inclusive, we have to ensure that we are listening to we are prioritizing lived experience. And in terms of menstrual health and hygiene, we're saying, or rather the community is saying, that health information has to be available in different accessible formats. In Braille, a girl or a woman who is blind has to be able to independently, with autonomy, go to the store and navigate the different products that are out there and pick and choose what makes sense for her, not having to rely on a third party or a second party to intervene for her. That we prioritize sign language, we prioritize easy to read format, we prioritize accessible toilets. This is a big thing when it comes to menstrual health and hygiene. A lot of rural areas in Kenya, a lot of the counties we work in don't see, bathrooms or the toilet as part of providing dignified healthcare. And that is a big impediment to how women and girls can access services, with dignity. So we are saying prioritize accessible toilet and wash infrastructure in general. We're saying that healthcare workers need to be trained in disability inclusive SRHR. We reiterating what Tara was talking about in terms of affordable menstrual menstrual health products. We are saying that we need to prioritize safeguarding in response to women and girls with disabilities. We also need to realize there's a lot of violence that happens to women and girls with disabilities. So safeguarding protection in our policies has to be prioritized, and that community-based support systems really help in reducing isolation and dependency. And so when we go back to shifting power, that again, reiterating that women and girls with disabilities are not only beneficiaries of menstrual health programs, that they should be leaders. We should conduct, market research and innovate better with their needs in mind. We have done this successfully with a number of companies in Kenya, but Mama Siri demonstrates that this is possible. And so other than, looking at it as an abstract, Mama Siri does this on a day-to-day basis. It looks at how care work can be transformed and can actually be led by those with lived experience. And I think such models need to be invested in. It takes a longer time, of course, and a lot of the time we realize in the development space, we don't have the time and luxury to provide space. But for programs to be truly inclusive and to start with those farthest behind, we need to create that time and space to allow for risk taking, to allow for mistakes to happen, and to allow for the community to have ownership in some of this work. Thank you.
Thank you very much. Thank you. And I would like to come back in the next round of questions, Lizzie, about the shifting power, because I think it's very interesting. What does it mean exactly? And Tara, I would like to ask you about your work that is cross-regional. It goes across Africa, Asia, Caribbean. Do you see that cultural, social, political differences across regions, across spaces make a difference, that how menstrual dignity can be achieved for everyone and realized?
Thank you, Esther, for your question. I think I would like to start answering by sharing like something that I think we learned with 100% is the fact that menstrual discrimination is something like universal, right? Like from Haiti to Pakistan to Cameroon to Benin, we see the same things going on, right? We see the lack of intersectionality. We see like the same people excluded, the pressure around like cultural like taboos around menstruation are all the same like across like the country. Their expression can differ, right? Menstruator can be excluded, for example, from social spaces in all of this country, not based on the same belief or based on the same like cultural like perception. But I also think that something that can like that work really well is that inside the project we are really trying with the partners to build an ecosystem. We are trying to build like regional, national ecosystem, which means that, for example, all the partners supported through 100% are not working on silo. They work together. For example, for tomorrow, for Menstrual Hygiene Day, all the partners from the Philippines and all the partners from Pakistan have worked together on a common collective communication campaign around the fact that menstrual dignity doesn't stop in times of crisis. So this campaign has been like led by both like the 100% partner across country, Philippines, and Pakistan. And I think it's really like giving us some tools, some tools in what can we achieve collectively. And it also, I think, like resonate a lot with what Lizzie shared about power. The fact that the 100% initiative is like deeply rooted in the partners' knowledge of like their context and what can be achieved like in their context. And this approach that we really want, like, it's not like just like South, like it's like cross-country, cross-regional. We really want them like to be in conversation, to facilitate like them being in the same room, having like the opportunity to learn from each other. I want to share an example, and I think maybe it's going to, yes, to speak for itself. We have like we have an organization partner in Pakistan called Mukeku Justice. So Mavari means menstruation in English. So Mukeku Justice, for example, has been doing like a lot of strategic litigation to bring into courts like the state of Pakistan on the issue of the tax, saying that taxing menstrual products is going against human rights. And we have, for example, an organization in Nigeria, a disability-led organization, who is like also super interesting in doing like strategic litigation. So we are facilitating discussion between them, so that they can learn like from what has been done in Pakistan. Is it something that they can replicate, or is it something that they will need like to adjust like to their context? How the idea like came to Mukeku Justice? What was the first step that they took when they were sure that this is the way that they wanted to take? So yeah.
Thank you so much. Indeed, it's a powerful initiative, and I think it's very important to talk about this initiative and share, because you may not link the meaning or the strategy of strategic litigation to menstrual hygiene or menstrual dignity. You often think that it's an access to care issue from the perspective whether and how products and services are delivered. And actually a legal policy framework around products can be also very powerful tool that is determining the access. Lizzie, my last question to you, and I would give both of you a short reflection, that what exactly the shifting power means that you mentioned, and what do you need that your advocacy is successful? What do you determine the key for success and progress in the context of time and space that you mentioned that it's needed for your program and project and work?
Right. Thank you. Thank you, Esther. For me, shifting power, or rather for us, shifting power is decentralizing power. A lot, historically, women and girls with disabilities have been, extremely marginalized, excluded from participating in leadership opportunities. And so with our Mama Siri, we are centering women with disabilities and their leadership. We prioritize women with disabilities in the community. We seek them out. And I keep saying we employ, because we think that their contribution to the work is important, and we employ them because this is not a voluntary service that they're providing. We pay for their time because we think their time is valuable. And that also needs shifting, because a lot of the time we extract a lot of information, a lot of data from marginalized communities in the development space without necessarily acknowledging their important contributions. So I keep saying we employ them because it's an important aspect of the work. So when we center women with disabilities and we put them in positions where, one, they begin to collect data in terms of the needs of their specific community, the needs around SRHR. But we then realize it's broader than that. We're not only collecting data around, the community is not only telling us that we need services around SRHR or menstrual health, for example. It broadens, it becomes land rights, it becomes gender-based violence, it becomes education, income generation. And this is important data that we then feed back into county processes. So in terms of changes within policy, we then position our Mama Siri to, and we package this information in a way that then she can translate it in county government spaces. And we then advocate for her to join those advocacy spaces. That also becomes a contentious issue because county governments come back and tell us that, Mama Siris are not equipped because one, they're disabled, maybe they don't have, the level of education that is required for those spaces. But then we are saying that lived experience is important. And so if we're saying lived experience is a critical aspect of this work, then surely we have to make space. And that's the type of space that I'm saying. But for that to happen, we had to do a lot of back end work as an organization to be able to position Mama Siri for success. So now she provides referrals to the community. She then collects this information, the referrals or the cases that are occurring, the violations. She collects these and she provides us this information, and we package it as data and we synthesize it as reports, and then we feed it back into the county advocacy spaces. And we are hoping with that whole loop. And sorry, I forgot. She also then works with a community of practice. She does not operate, by herself in a silo in her county. She works with healthcare providers. She works with organizations that provide access to justice, the local administration, the police. All of this create a bubble around her and support the work. So these are also partners that are beginning to learn what truly disability inclusive SRHR looks like. And then, the tangible, action points that we're asking government to take into consideration. So we think that that process kind of provides an opportunity for us to truly shift power and to position and center women with disabilities and put them at the center of this and position them for success. So that does not take 1 year, or it doesn't take 2 years. I've been doing this work for over 10 years, and for us to get to a place that we are now saying that we have data that can make sense to the county government, and we can, we have positioned Mama Siri and we have trained her, and she now actually whenever there's national elections, we lose Mama Siris because she is recognized as a leader, and she now vies for political leadership in her county. So I think, the concept of time and space is extremely important, and our programming and our work is a testament to what it can do. Thanks.
Thank you. So for both of you, a last reflection, like half a minute. We are in 2026. Gender justice, development justice, economic justice is shaping sexual and reproductive health and rights, and especially those who are very often most marginalized, but sometimes they are the most powerful because they are standing up. So what is your message for Menstrual Health and Justice Day in 2026 as a key takeaway for this day? Tara.
What I want to say is like to all the people menstruating, for also the one carrying that topic in different spaces, like in their communities, in their school. I want to tell them that what they are doing is not going to waste, even if they are not able to see for now like the immediate result of this. I want to tell them that what they are doing is a super valuable work, super close to what farmers do, right? They are preparing the ground for the next generation. They are planting, they are tending, and everything that they are doing, one time someone else will harvest what they have done. It might come in 2 years, it might come in 6 years, but it's really not going to waste. And we are already able to see the results of it when menstruation is being named in spaces where it was previously unspeakable. They have won. When it's appearing in parliamentary debates, they have done the job. When menstruation is speaking in spaces where it wasn't the case before, they have won. Yeah.
Thank you. Lizzie?
Oh, I guess for me, a world where no girl misses school because of her period. No woman experiences shame because of menstruation. No individual with a disability is excluded from healthcare because systems were not designed with them in mind. This on this occasion, I think it would be important to shift the conversation from what we started with, not, menstrual hygiene, but look at menstrual health as a public health issue and a human rights issue, and not a side conversation. And particularly for communities of women and girls with disabilities, that they are centered in these conversations, that they are seen and heard and funded and represented and included at every level, from product design to policy, to budgeting, to research, to healthcare delivery itself. Thank you.
Thank you so much, Lizzie, and thank you so much, Tara, and thank you for this ability and for Feminista for the fantastic work that you are doing. Thank you for this conversation. Those who are listening in our social media and audio channels, please visit our website. The blog page where we will post this podcast episode together with links to the work of Disability and Force Feminista, about more in-depth information about the project that you are doing. Thank you so much, Lisa and Tara, and thank you for listening.
Thank you, Esther. Thank you, Lizzie.
Thank you.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM Journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautond.